Hello everyone. So today we'll be talking about Bishop's score in very easy and simplified manner with the help of mnemonic, and at the end of this video we'll be also discussing one MCQ related to this applied aspect. And until the end of this video, you will be able to remember the Bishop's score in very easy and simplified manner. So what is the Bishop's score? It is a Edward Henry Bishop's this scientist has given this score, and it is a pre-induction cervical scoring system, and this is a scoring system done before induction of the labor. And we can remember the Bishop score by the mnemonic, the through its own mnemonic, like acronym BISSOF, where B stands for Bishop score obviously, and the I for effacement is just I obviously modified the spelling. Effacement, I for effacement of the cervix, and so we have something called as modified Bishop score given at 1991. And here, the instead of effacement, we have the parameter known as length of the cervix, and it's also same like in I looks like L, so length also looks like L, so we can easily replace I by L, and these are similar. So effacement is replaced by length in the modified Bishop's score. And if I for effacement, S for station of the fetal head, S stand for whether the cervix is hard or soft, that is consistency. O for opening, that is dilatation of the cervix, and P for position. And with this mnemonic we can remember the Bishop score very easily, and it includes 1 2 3 4 5 parameter for the scoring of the cervix. Now the talking about the Bishop score parameter in the detail, we have the effacement. So what is effacement? As we have discussed in the previous video on first stage of labor, effacement is the process by which the muscular fibers of the cervix are pulled upward and merges with the fibers of the lower uterine cervix, and this is known as effacement. And it is the cervix becoming the part of uterus. And we have the first effacement into 0 1 to 3 scoring system. If the cervix is effacement of cervix is less than or equal to 30%, 0 to 30, then it is score 0. If it is 40 to 50, it is 1. 60 to 70, it is 2. And if there is more than 80% of the effacement of the cervix, then it is the score 3. This can be remembered easily by the by like 30, 40, 70, 80. Just remember, no need to remember range, just remember 30, 40, 70, 80. In this way we can remember the scoring system: 30, 40, 60, 70. If it is less than 30, 0. Less than 40 to 50, 1. And 60 to 70, 2. And if more than 80, 3. And then we have the station of the fetal head. If the station of fetal head is below the scale spine, below the sky, if it is positive, positive means the positive station means it is the below scale spine. We will see through picture. So this picture shows the station of head in relation to scale spine. If it is more than if the head is less, it comes in the positive range, then the Bishop score is 3. And if it is either 0 or -1, then it is Bishop score 2. And if it is -2, then it is the Bishop score 1. And if it is -3, -4, or even more than or equal to -3, -4, -5, this is equal to Bishop score 0. So more if the fetus has head has descended down, then the score increases. If fetal head has is still upward, then the Bishop score decreases. So that is inverse relation between head and the Bishop score. So as we have said, +1, +2, if it is positive, then the score is 3. If it is -1 or 0, it is Bishop score 2. And if it is -2, then the score is 1. And if it is -3 or more than above that, then that includes Bishop score -3. And consistency of cervix, we don't have there are scoring up to 2 level. Maximum score is 2 in the consistency of cervix. And if it is maximum is soft, if the cervix is soft, then Bishop score is 2. If it is firm, then Bishop score is 0. And if it is between the firm and if it is medium quality, then it is 1. And the dilatation of cervix, if cervix is closed, not dilated, then that Bishop score is 0. If it is 1, then 1 to 2 is the Bishop score. 3 to 4 and more, if there is 5 or more than 5, then this is Bishop score 3. 1 to 2, 3 to 4, and 5 or more than that. And the position of cervix, again in this here also we don't have maximum score is 2. If it is position of cervix is posterior, it is 0. If it is in the midline, it is 1. And if it is position of cervix is anterior, then it is Bishop score 2. When after calculating, we have the total score here: 3, 3 2 are 6, 3 3 are 9, plus 9 plus 2 10, and we have the 9 plus 2 11, and 11 plus 2 13, and total score is 13. And favorable score is usually regarded as 6 to 13, and unfavorable score is 0 to 5. And we have the modified Bishop score, as we have said in the beginning of video. The length of the cervix, the effacement is replaced by length of the cervix. If it is if the length of cervix is more than 4 or equal to 4, then that is called as that is, if it is more than 4, not equal to. If it is more than 4, then the Bishop score is 0. If 2 to 4, it is Bishop score is 1. 1 to 2, that means Bishop score is 2, and less than 1, Bishop score is 3. Modified Bishop score. And the Bishop score is most common, as efficient of cervix can be accessed clinically. Bishop score, we can do it clinically, but the modified Bishop score, we have to do measure. The length of the cervix can be measured only in ultrasonography. So the modified Bishop score is most accurate, but it cannot be done with the USC. Clinically, we can only do the Bishop score. Now we'll see the question. Question is that the primary gravida came to the labor room at 40 weeks plus 5 days of gestation for induction of labor. On prior vaginal examination, cervix is 1 centimeter dilated, 30% effaced, and the vertex is 1 minus 1 station, and the cervix is soft and posterior. What will be the modified Bishop score for this lady? So let's calculate. So primary gravida come to labor at 40 plus 5. This is not necessary Bishop. And for induction of labor on PV exam, cervix is 1. So if cervix is 1 means the Bishop score is, just remember that cervix 1 is Bishop. Cervix 1 centimeter dilated means Bishop score of 1. And if the cervix is totally not dilated, then that is known as 0. And if it is dilated 3 to 4, then it is Bishop score 2. And if it is dilated more than or equal to 5, then that is Bishop score 3. So 1 to 2 is included in the Bishop score 1, and the plus. Okay, cervix is 1. And 30% effaced, that means it is Bishop score is 0. As we said, 0 to 30 is Bishop score 0. 30 50, 30 40 70 80, they are mnemonic. And the vertex at minus 1. Minus 1 vertex means the Bishop score of 2. And the cervix is soft and posterior. Cervix is soft means the consistency of cervix is soft means the B score is 2. Maximum score is 2. Only there are 3, that is firm, medium, and hard. So maximum is 0, 1, 2. 2 is soft. And the posterior means the score is 0. Again, for position of cervix, we have usually 3, 0, 1, and 2. Maximum is anterior means 2. So we are calculating this 2 plus 2 plus 1, that score is 5. So finally we have the Bishop score is 5, and this is the answer. So that is easy to remember. Just we have to mock up this table. If we want, then we can just screenshot this chart, and you can write your own note and paste on the front of wall, and you can remember this. So thank you. And this is one of the commonly asked question, and finally we have tried to remember it as easy manner as possible. Thank you, and we will meet in next video.